Hello all, this is Dr. Dheeraj Masapu. I am a consultant anesthesiologist and many people are asking me if we are panicky or if we are a little anxious, can we take up anesthesiology? So I would like to answer that in this particular video, and I would also explain a psychological concept called as psychic equivalence in this particular video. With that you will better understand whether you can take up anesthesiology or not. And it's not only anesthesiology, there are some branches like gynecology, general surgery, orthopedics and neurosurgery, and this kind of branches deal with critical moments. So in those kind of situations, if you are a little panicky and anxious, you can get into a situation called as mind block, where your brain stops working. So in that kind of situation, if it is in the milder form, that is okay. If you have that kind of a personality, whether is it wise to take up the branch first of all, or should you avoid taking these kind of branches? So this is the kind of question I would like to answer in this particular video. So first I would like to tell you what are the different types of anxiety that you face when you're dealing patients. So as a student, you might have different anxieties, like you would be anxious about your PPT presentation or a seminar presentation which is coming up. You'd be anxious about your thesis in protocol submission. You'd be anxious about your main exams, whether you'll pass or not. So that's a different topic. Even that is covered in this particular video at the end of the video. But I will predominantly focus on clinician anxiety when you're treating a patient, when you're stuck in a situation. So how to overcome that, and minimal anxiety will be there from everyone, but if you're totally a panicky person, whether you should opt these branches or not is the question I would like to answer. So I would like to answer that. So before that, I would like to tell you my particular story. So during my post-graduation time, from second year onwards, we were being posted in endoscopies and ERCP procedures alone. So I used to go to endoscopy and ERCP. And during the procedure, since I was being posted alone, I used to be, I used to get a little anxious at those points of time. And there are moments when the gastroenterologist actually complained to the HOD of the anesthesia that this guy is actually becoming more anxious, and send some senior or just talk to this guy. So at that point of time, my HOD called me, and what he told is, you're doing a good job, he told. Then I asked him why. So basically what he told me is, any anesthesiologist should be anxious about a procedure. So only a panicky and anxious person will prepare everything well for the patient. He'll be over prepared, which is actually good in anesthesia. Not only anesthesia, any branch, if you over prepare, it is better according to me. So that is what he told me. He didn't scold me actually, he actually appreciated me for becoming anxious. That means that I am feeling responsible for the case. And that is the message he has taken from that particular situation. So why I told this story is, so being anxious is okay. So minimal anxiety is fine, it should be there. So that actually is keeping your patient more safe according to me, because you prepare more for that particular case. So minimal anxiety is mandatory according to me. You become very anxious when moments are out of control, and you might go into mind block kind of situation. Even those kind of scenarios I have faced in my career. So for that, I'll tell you how to overcome those things in this particular video. So then even seniors, after 10 years, 15 years of experience also, so even though they look confident, they will have some panicky areas in their spectrum. For example, if you get a patient with low ejection fraction or severe pulmonary arterial hypertension for a non-cardiac surgery, or a pediatric patient for a complex surgery, so you might be comfortable in dealing some type of cases where you don't feel anxious, but you might be actually having you might feel anxious while dealing different set of patients where you're not very comfortable with. So anxiety will be there for even senior guys, but it will be a patchy anxiety. So they won't have a generalized, for every case they don't feel anxious, only patchy anxiety. For very critical cases they might feel anxious. So that you need to understand. And students actually feel very anxious when seniors are actually observing when they're doing any procedure. That is what I observed. So when I was doing a procedure, if my senior is there, I'll feel a little anxious, and when my junior is doing a procedure, if I'm there, they might feel a little anxious. That is very common thing, and you have to overcome that. There is no other way, because always there will be some senior along with you, and you have to overcome that. I'll tell you how to overcome also. And the world is changing, and many patients actually, when they come for the pre-anesthesia checkup, they try to tell that they're so and so and they're a VIP and all that. Those kind of stuffs also are happening nowadays. So even the patient profile, a high profile patient or a patient profile, also puts the anesthesiologist or the concerned specialist in some form of anxiety, even though they don't show it openly, but there will be some amount of anxiety. That's why sometimes problems happen also. That is not actually good according to me, but that is how the world works. So, and how to overcome that is what I'm going to tell you now. So here I would like to tell you a concept called as psychic equivalence. So psychic equivalence is, see, when you check in into a hotel, you've taken a room, and then suddenly the manager tells you that, sir, this room is very good. We have treated this room for bed bugs, and now there is no bed bug. That is what he has told. And you checked in into the room and you started sleeping on the bed. When you actually sleep on the bed in the night, you would be thinking, what if all the bed bugs are not dead? What if 1 or 2 bed bugs are still on the bed? And the whole night, if you get some kind of a pain, you would be thinking that bed bug is actually biting you. So it is a false feeling that bed bug is there, and you will actually feel that the bed bug is actually biting you. That is called as psychic equivalence. So this kind of situations actually will happen if you are a very anxious person. So minimal anxiety is fine, but if you are a very panicky and anxious person, you will go into psychic equivalence. For every case, you will be thinking that this might go wrong, that might go wrong. In reality, those things are rare. They might happen only 0.1% of the times. But when you get stuck with the psychic equivalence, you'll be thinking that 50 to 60% of the times in that particular patient this is going to happen. So that is another problem. So for that, I'll tell you a solution. So according to the psychology and literature and everything what I searched, they say deep breathing, meditation, mindfulness and all that, and even cognitive behavioral therapies called CBTs and all that they recommend. But practically, I'll tell you a simple way. You have to get exposed to that situation multiple times. For example, in the same hotel, you are sleeping. First day, you will feel that bed bugs are biting. Psychic equivalence is the second day you sleep, the third day you sleep, that fourth day you sleep, fifth day you sleep. After a week, that place will become comfortable for you. You'll no more feel that bed bugs are there because your brain is used to that particular situation since it dealt it multiple times. So that is how you need to deal even anesthesia in any particular field. When you're anxious, you have to get exposed to that particular situation multiple times. So initially you need to have some kind of a support system like your senior, but later on you need to get exposed to that particular situation multiple hundreds of times, and then that complex situation will come into your comfort zone and you'll no longer feel anxious. That's a simple solution. That is why people tell we want experienced people, we want people with 10 years experience, we want people with 15 years experience. In surgery, some people expect 20 years of experience when they're getting operated. So why this experience matters is, over a period of time, most of the zones will come into your comfort zone. So most of the zones you deal with ease, you don't get into mind block. So the solution is doing multiple cases repeatedly and getting stuck with problems repeatedly. When you expose yourself to all the situations, then over a period of time, all the anxious situations which you felt before will come into the comfort zone. That is how you need to deal. So, but the problem is, everyone won't get the opportunity to get stuck in the problems. So what nowadays in developed countries and even India they're doing is simulations. Simulation workshops are being conducted, and some hospitals have their own simulations. So you need to get exposed to simulations where a scenario of cardiac arrest will be given, a scenario of hypertension, a scenario of blood loss, a scenario of some major vessel being cut and how to repair. So many scenarios will be thrown to you, and you have to act and do a role play and show to them, and then you take a certificate from there. So when you repeatedly do simulations, what happens in the subconscious level, subconscious will be thinking that you're actually doing those cases, and then over a period of time those anxious zones will come into your comfort zone. This is another way of dealing, getting rid of the anxiety. So these are the two main ways for doctors. So all rest of the things is deep breathing, mindfulness and all those things won't work out for us practically. So but what I suggest for the very anxious people is, you can take up anesthesia, not an issue, but try to work under a consultant or assistant professor for a duration more than a common person. So you try to work for 3-4 years more, and then you will become more confident. That is a simple solution. And also, alternative anesthesia techniques also need to develop. For example, general anesthesia is risky. So why don't you do a fellowship in regional anesthesia and try to do cases in regional anesthesia, so that the risk will come down to the patient. So the number of complications will come down. So you need to find out alternative ways to anesthetize people, and in other branches you have to find out if you can make the procedure more simpler than being more invasive, that would be better for the patients also. So that is these are the simple ways to get rid of the anxiety. And my answer, I already told you, if an anxious person can take up anesthesia, answer is totally yes, you can take up anesthesia, but you have to take some extra time. Maybe you have to invest another 3 to 5 years working under somebody who is very skilled. And then once you feel you're totally fine and you're ready to take over, then you start your individual practice. So that one more thing is left. For students who feel panicky, students usually don't feel panicky for situations like this. They feel panicky when they have a presentation or a thesis, or thesis submission date is coming by. That is when they feel panicky. For that, I have a solution. So for that, what you need to do is, students should stop postponing the things, or procrastination should not be done. So basically, they have to finish the stuff. You finish most of the thesis work and everything. If you finish off in the first 2 to 3 months, it will be very helpful for you. I mean, the submission and protocol and scientific committee and ethics committee. Later on, the data collection and everything, if you finish off in the first year, then by second year your job with thesis is over. So that is how you need to get rid of thesis. And presentations, the day you get the date for presentation, you start preparing. You make a high quality presentations, try to rehearse and try to shoot the presentation and see where you're going wrong in a simple cell phone. And in that way, actually, you can overcome the anxiety. So, and some students say that we don't have time, our center is very busy. So who is free in the world? Everyone is busy. So now for that solution is, you have to work in micro slots. In between the cases, if you have 5 to 10 minutes gap, you have to work in that. And before starting the OT, after preparing the OT, before patient comes, if you have a 5-minute slot, then open the tab and then keep doing your PPTs and start reading some articles and keep searching for your thesis. So don't focus only on your examination. That is a very old concept. Now you have to focus more on going good theses, and you have to focus more on presentations and everything. I have done many videos before addressing these issues. So that's it, guys. Thank you. As usual, Dr. Dheeraj Masapu logging off. Roger that.